Hi guys, it's your girl Naya. I apologize for not making a video earlier. I have been recovering from a total knee replacement in my right knee. So I just wanted to talk a little bit about that. Like I said, had the knee replacement January 26th. So I'm about 6 weeks out right now. This was personally my sixth surgery, major surgery. And for me, personally, what they did was they kept the patella and then they replaced every other part of the knee with titanium. And I have rod and screws in my femur, so they didn't have to remove that. Luckily, I was just able to have the knee replacement and I didn't have to have anything done with my rod and screws. And after surgery, it was like instant that they wanted me to get up and walk. I did have an immobilizer on and the pain was really bad right after surgery. But they wanted me to get up and make sure that I was moving and everything. And so I did that. I stayed in the hospital for 2 days because the pain was really, really bad. And I have a high pain tolerance, but it was just a lot for me to handle just because I hadn't had a surgery since 2011. So it had been 15 years since my last major surgery. I've had procedures and done all of that, but this was more extensive. And my last surgery, I was 18. So it just took its toll on me, I guess. And like I said, I had an immobilizer on. So after the second day, I did go home and I was told to move every 2 hours to avoid blood clots. And I did that. And just tried to gain my strength. The muscle that hurts the most, even to this day, is the quad muscle. And I feel it above my knee. I do have a scar that runs all the way from here all the way down. And excuse the mess. And I'm not very electronic literate, so I could have cut this and tried to show you differently. But I do have a long scar, and they only did one scar. Luckily, when I had the surgery at first, when it was wrapped and everything and I couldn't see it, I thought that they had three insertion places, but I was wrong. It's literally just one big long scar. They didn't mess up my Ursula tattoo. They went right underneath it and did it that way. After the surgery, I followed up in 2 weeks and everything looked good. What the doctor said, everything, and that's when I was first able to see it. So he said everything looked good, looked like it was healing well. The only problem that I did have is that they taped me down. I'm assuming, not assuming, they did tell me. They taped me down to the table, and moved my chunky self stuff right by my thigh, and I had an allergic reaction to the tape and it burned me, even though I had told them that I have an allergy to adhesives. And I know I'm saying a lot. I apologize. But that was really the extent of any reactions that I had, was just to the tape that they had used. I actually didn't have a reaction, luckily, thankfully, to the tape that they sealed the scar with. But it was super hard to come off, and I had the adhesive stuck to me. So I had to use the adhesive remover wipes, the medical ones, not like Goo Gone or anything like that. Please don't use Goo Gone to remove the adhesive. But I did that, and then after the 2 weeks, I had to follow up again in another 4 weeks. And this whole time I was forbidden from driving. And that is really hard for me. I am not a passenger princess. I am the driver. My, oh, Brandon cannot drive. He's going to get mad at me for saying that, but oof. But I am very appreciative of him taking me to my doctor's appointments, taking me to my nail appointments, because your girl had to have short nails for her surgery. And I'm sure everybody knows that that is not me. And I luckily have my claws back. But that was my torture, was having short, plain nails. But anyway, back to the surgery. I was not allowed to drive, obviously, because I had the surgery done on my right leg. And even if I had the surgery done on my left leg, I would have still been forbidden to drive while healing, because I was on medications. The medications that they prescribed me out of the hospital were gabapentin, Eliquis, ondansetron or Zofran for nausea if I became nauseous, and hydrocodone. It originally was 7.5s, but the pain was too bad, so they bumped me up to 10, 325. And I was on that for 4 weeks. And then I just followed up with the doctor at my 6-week follow-up, and I was cleared to drive. I was so excited. And they bumped my medication to tramadol with acetaminophen, which I'm not sure really works, but I am looking for a pain management doctor in San Antonio, if anyone actually knows of any that would take Molina, Medicaid, Medicare. If anyone has any recommendations, please reach out to me and let me know, because a lot of them are telling me that they aren't taking new patients, or they're not taking my insurance. So that's the struggle that I'm with right now. And the x-rays looked good. Everything looked the same from when I checked in 2 weeks ago. And it's healing. My scar is fully closed, fully healed. I can submerge it in water. No scrubbing, obviously, because it's still very sensitive. And just going from there, I am doing physical therapy twice a week at my house right now. I did just get referred out to physical therapy in like a rehab facility, outpatient physical therapy. So I'm going to go back to my physical therapist, Dr. Beth, and see her and start physical therapy there. Then I had been released also from my nurse that would come every week, basically just to check on my scars, see how I was healing, check my blood pressure, my pulse, and everything in that regard. So I've been released from there and don't have to keep seeing a nurse every day. And the biggest thing that I'm having a problem with is that I am having a severe amount of nerve pain. I've had nerve pain before, and I was prescribed gabapentin and it didn't work. But this nerve pain is more severe. I am having nerve pain pretty much 24/7. But the weird thing is that I am not having it in my knee. I have a little, I'm not saying that it's completely nerve pain free, because I still have pain in my knee right now. It's in my quad, like I said, it's in the top of my knee. I am walking. I was moved from my walker to my cane, and I do walk a little bit without my cane, like to go to the bathroom, and I'm progressing. But the nerve pain is in my hip and my thigh, primarily in my hip on the outer side, and it is intense. I feel like I'm constantly on fire. Like right now I have it, and I'm with XLH, my XLHers. I'm sure you know that you just have to sometimes get used to the pain. They did increase my gabapentin to 300 milligrams 3 times a day, and obviously it's still not working. I know that you have to give your body time to adjust to a medication, but it's not working. And I feel like the tramadol isn't working at all. And I'm also on methocarbamol, and that doesn't help with the muscle spasms, because my left leg, is compensating for my right leg. and is having muscle spasms, and the methocarbamol isn't really doing anything. And I'm not on here to complain. I'm just trying to give my story just so someone, if they need help, if they want to watch, if they want to help me, that's what I do these videos for. And so if anyone has any recommendations on things that can help with nerve pain, please let me know. I've been told to switch to Lyrica or switch to pregabalin, but they said that they were going to just try to increase my gabapentin at this point and then see what they can do. They did refer me out to have an EMG done. I have done one in the past. I don't remember what the results were. I know that I have nerve damage in my leg and in my back, but they want to see exactly where this, not necessarily new, but like progressing nerve pain is coming from, whether it be from the knee, the hip, the thigh, or the back, or all of the above. So I should be getting that done next week, and I will do my best to make another video to explain the EMG test and the extent of it, and the results, because I see the doctor again the following week or the week after to get the results, and we shall go from there. If anyone has any recommendations or any ideas to help me heal and progress in my healing with this knee replacement, please let me know. I am open. I am all ears. Personally, the hardest struggle with this surgery is I keep pushing myself and I keep trying to enhance my healing, I feel, because with my other surgeries, I had a fixator. I had something physical that I was able to see. And yes, I have a scar with this surgery, but with the physicality and literal being able to see that fixator, I felt like I had surgery. And that's a whole other topic. That's a whole other scenario. But with the surgery, my mental is like I'm treating it as if I had a procedure, so I need to bounce back. I should be bouncing back. There's nothing big that you can physically see, and that's wrong to think that way, because I did just have a major surgery. I need to not push myself as hard as I am, but I'm scared. My ultimate fear is that I'm not going to be able to walk. With my last surgery, I lost my ability to walk short distances, and this one, I'm just scared of not being able to walk at all. And so I'm pushing myself to walk to the bathroom. I'm pushing myself to walk to the kitchen. I am pushing myself to do things in a faster pace than I probably should. But like I said, my fear is not being able to walk. I primarily use a chair. I primarily use my scooter, and even for short or long distances. And the hardest thing of not being able to drive was a struggle for me, because it was my independence, my freedom, my way of getting out in the world. And even now that I've been cleared to drive, I'm scared to drive, because it is a lot. Like, it doesn't hurt, but I am just fearful of my knee. And so that's what's been going on with me. Again, if you have any recommendations, any ideas, any questions, any concerns or anything, please reach out to me. You know my socials. I'm on Facebook. And yes, it is me. It's a picture of me and my grandfather when I was a baby. I'm on Facebook. I'm on Instagram, TikTok, Snapchat, all of the above. Mind you, I am electronic illiterate, so it might take me a while to reach out to you or to find it. But I appreciate everyone for watching this video. Thank you so much. See you guys later. Bye.